Great. So thank you everyone for joining us today. My name is Cameron Curtis. I'm the president and CEO of the MedEvac Foundation International and the Association of Air Medical Services. Happy EMS week. It goes without saying too often. Thank you for everything you all do, to support your communities out there. We really appreciate it. We recognize it's been particularly hard during COVID-19. So today's topic is the impact of fatigue on EMS crews and patient outcomes and how to avoid it. I think it's a really timely topic, again, considering everything that you all have had to do on top of what you normally do to protect your communities. EMS provider jobs are inherently stressful. We encounter routine patients, but also patients with significant illness or injury who we may not be able to save. These encounters are memorable and may adversely impact clinician health and well-being. In addition, as I mentioned, we have COVID-19 to deal with and the unknown transporting patients who might or might not be contagious. As emergency clinicians, we often fail to ask for help when needed. Chronic and acute stress with recent transports, fatigue, and other factors can add to the challenge of taking care of ourselves and may even have an impact on patient care. Our goal today is to give perspective on addressing fatigue, sleep, and other factors that may impact your well-being during this extraordinary time and offer some tips on fostering resiliency by avoiding fatigue and the symptoms it causes. As CEO, I, on behalf of our board, staff, and volunteers, especially our donors who together make this possible, welcome everyone. We have about 100 people on this call and you're joining us just after the fact. Thanks for seeking us out. Now I'd like to introduce Jared Hughes, who is our new Director of Development at the Foundation, who's, by the way, it's his birthday, so happy birthday, Jared. And he will introduce our panelists today. Go ahead, Jared.
Thanks, Cameron. Oh,
there you go.
Oh, thanks, Cameron. Appreciate it. I'm really glad to be celebrating my birthday with all of you. And if I can, I'd like to put in a plug for our Run to Help the Helpers virtual run, walk, roll, taking place now through the end of the year. And when I blow out my candles tonight, I'm going to wish that every one of you will have gone to our website today and signed up for one of the several different distances that we're offering. We've got a 1K, a 5K, a 10K, a marathon, and 221 miles by 2021. So if you're a runner or a walker or like to rollerblade or are in a wheelchair, whatever is your situation, we'd love to have you participate. So please do check that out on our website at medevacfoundation.org. So let me introduce our panelists. Krista Haugen is she's an RN, an MN, CMTE, and Director of Patient Safety and Medical Risk Management at MedTrans. Krista currently serves as the National Director for Patient Safety and Global Medical Response there. She has 25 years of nursing experience consisting of emergency, critical care, and flight nursing. She survived a helicopter crash while on duty in 2005 and subsequently co-founded the Survivors Network for the air medical community. Krista served as a member of the FAA's Rotocraft Occupant Protection Working Group. She speaks at safety events around the country and has written for several industry publications. Her professional interests include crew resource management and human factors, just culture, medical transport, risk mitigation, post-traumatic stress, and resilience in critical care professionals and emergency responders. Welcome, Krista. Next, we have Dr. Daniel Patterson. He is an associate professor at University of Pittsburgh, where he holds the James O. Page Professor of Emergency Healthcare Worker Safety at the Department of Emergency Medicine. And Daniel is a nationally recognized paramedic and fellow of the Academy of EMS, where he is an FAEMS. He studies safety in emergency care settings with special emphasis on safety culture, fatigue, shift work, sleep, health, teamwork, medical errors, and adverse events, and clinician injury in the pre-hospital EMS setting. Collaborations have led to creation of reliable and valid safety measurement tools and establishing base rate data for key indicators for EMS safety. I might add, by the way, that several of those studies were funded through the MedEvac Foundation, so your donor dollars at work. He has led multiple disciplinary teams in evidence reviews and experimental studies testing novel interventions to improve safety. His research is informed by immersion in the EMS setting as a paramedic clinician. Welcome to you both. We're really delighted to have you, and it's an honor. And I think we're going to have Krista, if you would please start us off.
There we go. Hey, good morning from the West Coast. Good afternoon to everybody in the East. Thank you so much to AIMS and MedEvac for hosting this today. This is such an important topic and certainly one that's near and dear to my heart. Happy EMS week, everybody, despite the current conditions. So, you know, when I originally talked with some of the folks at MedEvac about how we wanted to present this, I was asked to talk about sort of EMS culture and stress. And I was like, wow, that's a big topic. And so in order to sort of get my thoughts out, I threw them all out on a whiteboard, which I'm going to be glancing at over here. So if you're wondering what I'm looking at, it's my notes for today. So the first thing I wanted to talk about was the people. You know, you think about who you were when you went into this line of work, the people that come to work in this line of work, what kind of people are they? And they are the people that are compelled to help others. They're smart, they're driven, they're motivated, and they have this sense of duty or this calling. Really, I've heard a lot of people say that this is a calling to help other people. And what an incredible, what would we do without them? They are the safety net of our society. And so when you think about the inception of EMS, air medical transport, really isn't that old in terms of, you know, industry in this country. And, you know, the intent when EMS started and air medical started was great. You know, we're going to go out, we're going to help patients, we're going to transport them to the appropriate facilities to receive the care that they need. And I sometimes wonder if anybody sat down and said, you know, the folks that are doing this work are going to be exposed to a lot of significant trauma, illness, injury, human suffering. You know, I wonder how that's going to impact them. And, you know, if that wasn't thought about, it's probably just because they didn't think about it. They didn't know. But now we know because we have some decades under our belt. And we've seen sort of the fallout from this kind of work on our individuals. So when we talk about EMS culture, you know, what is that? I mean, there's just such a wide variety of cultures across the country. It depends on where you are, the history of your organization, whether you're rural, urban, fire-based, volunteer. There are all sorts of variables that create a culture. But I think that there are some common themes within those cultures. And one of those themes has traditionally been, you know, our people just go out, or we just go out, we do the work, and we go home, and then we come back and we do it again. And when we talk about things like, you know, how that impacts us as individuals, we've had kind of a suck it up mentality, which we know now doesn't work whatsoever. It's completely non-productive. And so it's really wonderful that we're taking the opportunity to talk through some really hard things today so that we can figure out how to be predictive with our people, how to help them mitigate the impact of this work on their lives. And there's you know, multiple really great reasons for this. One, think about people. Think about yourself when you first started. Think about your new hires, and they come into this and they're enthusiastic and they're maybe idealistic and they really want to help everybody and save the world, right? What a wonderful bunch of people. We want them to continue to find joy in their lives. We want them to have sustainable careers. But from where I sit in the patient safety realm, how our people are directly relates to safety, their safety and patient safety. The model that I use for risk management has components of accountability, personal accountability, shared accountability, which is one of the foundational tenets of just culture, but I sometimes think we forget about the shared accountability piece when it comes to looking at ourselves in the mirror as organizations. Human factors, the human factors analysis and classification system, crew resource management, which doesn't belong exclusively in the aircraft. It also belongs at the bedside in clinical practice. It also belongs in an organization. And all of that in the context of a just culture and under the umbrella of a high reliability organization. So when we think about our people, how well can they execute crew resource management? How well can they manage human factors if they're fatigued, if they're maxed out stress-wise, if they're not feeling supported in their environments? So how our people are doing directly relates to things like maintaining situational awareness, managing distractions. How well do we communicate when we're really maxed out? How well do we resolve conflict? How well do we work as a team? how well do we make decisions, and how good is our judgment. And so all of these factors, all these variables that go into crew resource management are contingent upon the health and well-being of individuals, and that goes directly to patient safety and the safety of our folks, as far as I'm concerned, from a patient safety perspective. So we know that our folks go into this, idealistic, they want to help, and then they get exposed to the day-to-day human suffering of others. And then you can add on top of that critical incidents. You can add the loss of coworkers. A lot of us in the industry have lost coworkers to either suicide or accidents or those types of things, crashes in the air medical transport industry. And so this creates a burden. And, I want to point out that I think people in this industry are incredibly resilient to begin with. And so that can't be lost in this conversation. We're going to be focusing on, some of the issues that people have. But I think we have to remember, at the end of the day, people are incredibly resilient in this industry. So how do we support them, and how do we keep them that way? So that said, this burden that people begin to carry, many of you have probably heard the theory about the backpack. You have a hard shift, a rock goes in your backpack. You've got a difficult patient, a rock goes in your backpack. And so over time, this sort of becomes insidious until you're carrying a really heavy load and you don't even realize that you kind of come that far in terms of the heaviness. And so, not everybody's going to develop post-traumatic stress injury or disorder. Not everybody's going to express suicidality, of course, but people are carrying a significant burden. And why is that? Well, things like cumulative stress, burnout, moral distress, the second victim experience, which is really important from a patient safety perspective and how we manage adverse events, depression, anxiety, of course, fatigue, and then the tip of the iceberg, which is things like post-traumatic stress disorder, suicides, and those types of things. So pre-COVID, we as an industry in EMS and our medical transport industry have a lot that we're carrying. And some organizations have done a wonderful job of recognizing that and instituting measures to help mitigate that, like trained peer support teams. And I think that some of those folks are probably on the call today, and I'd love to hear, how those things are working for you. Most of the people that I've talked to who have done that find the return on investment is absolutely incredible and worthwhile. So there has been significant progress made across the industry in recognizing what our folks are up against and what we can do to mitigate that. And I want to point out too, we're not just talking about clinicians, we're also talking about our pilots, our comm specs, the people behind the scenes, the leadership, everybody really that touches EMS and air medical transport is carrying a heavy load. And especially now that we've added a pandemic to the picture. So it's interesting because I'd love to know how those organizations who have put these measures in place and help to mitigate the burden that some of our folks are carrying, their cup is maybe more full coming into sort of a crisis situation like this. And I think that's really important because, this work isn't going to get any easier. And so, we're always going to be up against human suffering. We're always going to have these, catastrophes and disasters and things like that we have to contend with. So what can we do to bolster our folks and support them and hold them up as they do this really important work? So enter COVID. And now on top of everything else, we have this uncertainty of epic proportion. And I think most of us don't like uncertainty whatsoever. We are the people that bring order out of chaos. We are the rescuers and the caregivers, and we are the fixers. And so uncertainty is really challenging for us. And it can kind of bring on a sense of powerlessness and maybe even hopelessness in some cases. And so, we hope to give you some tools today to help mitigate that. The other thing that COVID brings, obviously, is fear. I've seen, anger flare up. If you look at social media, there's a lot of fear and a lot of anger. There's the fatigue and exhaustion. And then the other piece is information overload. and all of the energy that it takes to separate what is legitimate, evidence-based information versus the noise and the politics and the conspiracy theories and those kinds of things. And, you know, one of the things that we can do, you know, one of the things that is in our control is to limit our exposure to a lot of information. There are people that are maybe not feeling extraordinarily impacted by this, and that's okay too. And I think it's important to remember that these are all normal reactions, and they're all individual, and people respond individually, and one person's experience is no less valid than another person's, and it's important that we don't compare. But I think no matter where you fall in this, on this continuum, you're not alone. So we look at the complexity of the EMS culture pre-COVID, we look at the complexity after, you know, during COVID, and we see all of these different people in these varying contexts. So we've got people that are on the front lines, decked out in PPE every day, dealing with patients who are diagnosed with COVID. We have people that are home working remotely, you know, maybe feeling guilty. Like for myself, I'm a nurse, and I'm used to being shoulder to shoulder with the folks on the front lines. So maybe there's, you know, there's a little bit of guilt of not being up there on the front line for me. People have to homeschool their kids. People have family members that they're concerned about. I know multiple people who have lost family members during this time, and whether or not it's due to COVID, the normal support systems aren't in place. We can't gather with our families, we can't gather with our loved ones. And so there's just this incredible variety. And I guess that I point all of that out to say, in order to address this, we really have to appreciate the complexity, and that responses are individual, and really at the end of the day, we need to meet people where they are. There aren't really any kind of cookie cutter solutions to this. And we say, well, how do we do that? Well, I think the key is to be trauma informed, to understand what impacts people, to understand why they're impacted, and to understand how to respond to that. And this takes a multimodal approach. And, you know, I personally use a very eclectic approach to stress management. I look at the military literature. There's some wonderful books written by people in the military. I look at psychologists. I look at the spiritual world. I look at fitness, wilderness, all sorts of different resources, because different things appeal to different people. But really, I think the bottom line, and one of the biggest take homes I want to send you home with today, is the degree of, I think, vulnerability and shame that, you know, are massive barriers to people coming forward. And so I'm transitioning right now from my role as a director of patient safety at MedTrans to director of patient safety at GMR. And so my successor, Kevin, at MedTrans, the first thing that I asked him to do in his onboarding was to watch Brené Brown's TED Talk on vulnerability. And that might seem squishy, but it's not. Because if we are not if we're not willing to be vulnerable, and this is what I told Kevin, we in these, you know, patient safety roles, leadership roles across the organization need to be the kinds of people that our employees will be vulnerable with. So if I want somebody to report an adverse event, whether or not there was harm, if I want them to report close calls, if I want them to tell me that there's something wrong with the system that we've created, or that, you know, my policy has ambiguous language and isn't guiding them, if I want them to tell me that they're fatigued, if I want them to tell me that they're struggling, I need to be able to receive that information and create a culture where people are comfortable being vulnerable, and where we can start to push away the shame and say, look, we're all human. You're not alone in this. We're gonna give you some resources, and we're also gonna look at ourselves to see how we can optimize the environment that you operate in. So the vulnerability and shame piece, I think, is really important. And, you know, I didn't add Brené Brown's work to the reference list, but I would, that I sent you, but I would definitely add that. So there are, you know, it's not all doom and gloom. There are a lot of things we can do. Just to wrap up here so we can get to Dr. Patterson. Organizationally, we need to meet people's physiologic and safety needs. I mean, that's just the base of Maslow's hierarchy, right? And provide a sense of belongingness. You know, to have a team or a tribe is something that really helps to ward off post-traumatic stress. Providing education, resilience. People come into this industry with these expectations. Let's get them at new hire And let's adjust their expectations, and then let's do periodic education after that. Train peer support teams, streamlined access to qualified clinicians who understand trauma and understand this population of professionals, suicide prevention initiatives, substance use and addiction initiatives, a disaster mental health for both internal and external disasters, a second victim experience education and a leadership training for that is really important. And then certainly resources like our chaplains, psychologists, and counselors. And then as individuals, there are so many cheap and easy things we can do. Tactical breathing, you know, box breathing, inhale for 4, hold for 4, exhale for 4 to 6, hold for 4, you know, used to be called square breathing, but we have to appeal to the, you know, the badasses that are in EMS. And so we call it tactical breathing because that's what the military calls it, right? Progressive muscle relaxation, talking, journaling, cry when you need to. It's okay to cry. Go outside for a walk, pets. Remember, it's okay to laugh and to have fun, even in the midst of difficult times. Good nutrition, good hydration, and monitoring your energy. You know, this is basic economics. If I don't have it's about supply and demand. How much energy do I have to take on other people's issues versus, you know, the demand versus the supply that I have. If I don't have the energy, then maybe I need to step away and restore myself and kind of fill my cup back up a little bit. Getting good sleep and rest, which Dr. Patterson is gonna talk about in much more detail. Just being able to unplug, decrease exposure, go do something completely different from COVID, and gain perspective. You know, when you're in the midst of a COVID unit, sometimes it starts to feel like everybody has COVID, right? Kind of like working, you know, when I worked in the pediatric ER, I was sure that I don't know how any child got through life uninjured, right? It changes your worldview and perspective sometimes. Practicing gratitude, remembering the things that we're grateful for, meditation and mindfulness, and there are some great apps for that. And then just having realistic expectations of ourselves. So, and I think at the end of the day, compassion and extending grace to those around us, and then also equally as important, ourselves, will really help us to get through this. And with that, I'll turn it over to Dr. Patterson. Thank you.
Thank you, Krista. That was great. And you know, it's the thing that I like best about these wellness webinars is that although we're speaking to our EMS providers, these are all things that I think anybody can use in their daily lives, whether you have a patient's life on the line or somebody like me. I know that the quarantine has been hard on lots of people. So I would just want to say thank you. It's been great listening to that. And I've had lots of people, this is a home run, great information, speak again. So thank you. We appreciate it. So now we'll turn to Dan Patterson, and he can talk to us about fatigue.
Okay, thank you. It is a great pleasure to be with you today. Great information by Krista, and I would really like to reiterate a lot of what she said about vulnerability and recognizing that it's okay to be that way, not only as an administrator, but also as a frontline clinician. This kind of talk is a little bit different from a traditional research related talk that I do mostly. And therefore, I want to kind of walk through what I imagine doing as a clinician on the topic of sleep and fatigue when preparing for, during, and after a shift. I still work in the field. I do a 16-hour shift, usually on Friday evenings. It's an overnight shift. I think it's very important that as an investigator, that we stay in touch with the reality of what goes on the ground to make sure that the research is informed by the reality. It helps us figure out what's feasible, what's not feasible, what can be turned into protocol and policy, and what may not be, and what is needed for the EMS workers. So I'm just going to begin with, first, sleep is important. I don't think anybody on the webinar today would argue with that, but as many of you have read in the news or read some of the research, or maybe have received some information from your administrators who have tried to emphasize the importance of sleep, many in EMS do not get the sleep that they need. Pre-pandemic, our data would show us that, or has shown us, that pretty consistently half of EMS personnel get less than 6 hours of sleep per night. Now, our data has also shown us that many EMS clinicians who are allowed to nap on duty, if allowed, and if the volume is low enough, are able to get some sleep during shift, which is very helpful. But the fact is that the sleep patterns that EMS clinicians have is pretty chaotic. I would say the vast majority of EMS workers in ground and air medical do not really have what we would say is a consistent sleep schedule, and lack of consistency really wreaks havoc on our sleep quality, and that can have a lot of downstream impacts on our performance, on our health. And so one of the things, number one, to recognize and to actually maybe take more seriously than you have in the past as an individual clinician, or maybe as an administrator, is that the amount of sleep is important, yes, but the consistency in that sleep is also important to help with the ability to get adequate sleep. When you have so much inconsistency in bedtime and rise time, it can cause so many problems for getting not only adequate sleep, but also good sleep, good quality sleep. Good quality sleep is defined as not only the duration, but also minimal interruptions, good sound sleep, good efficiency. And good efficiency refers to the ability to fall asleep in a reasonable time. That means, within 11, 15 minutes, and to be able to wake from your sleep feeling pretty refreshed. And I can say that that's probably not very prevalent in EMS. A lot of folks have maybe potential problem falling to sleep at different times of the day, especially if they're coming off a night shift. And then when they wake from their sleep, they may not feel refreshed. So that is a sign and symptom of poor quality sleep. So again, point number one, get adequate sleep when feasible. Try to be consistent with your rise time and wake time if feasible. It's not always feasible, but if feasible. For many EMS clinicians in response to COVID, things have changed. In some locations with higher caseloads and higher volume of potential infectious patients, the workload may have increased. And therefore, what we've just heard from Krista about, the stress level, the anxiety, the worry, the fear has potentially increased. And there is plenty of research out there to show that when those types of cognitions are prevalent, our sleep is impacted in a negative way. And so that's going to happen. And that's one thing that you should just accept is probably going to happen, and don't beat yourself up and try to find reasons outside of what is actually going on as being potential influencers of that. That fear, that stress, that anxiety will impact your sleep. One way to deal with that is to talk with your partners, your family members at home, to try to, as best as possible, when you are trying to get your sleep, to reduce noise, reduce disruptions, protect that time as much as possible. It's not always easy, but as much as possible, maybe re-emphasize to family members that this is a very important period of my 24 hours, being able to get adequate sleep and uninterrupted sleep. It will help in terms of reducing stress. It will help in terms of reducing some of the anxiety that's there. Lack of sleep, if you continue to get inadequate sleep, it's just going to exacerbate the problem and prolong recovery from not only your shifts, but also from the anxiety that has manifested from the exposure to those types of patients and the fear. Other things to mention is that when I go into a shift, there are strategies, there are evidence-based strategies that I try to follow. I don't just try to do the research and tell people to do as I say, not as I do. I actually tried my best to follow the evidence as best as possible, and have no shame in admitting it's not always possible. It's not always possible. I have kids myself, and you know, with kids and with other issues, things don't always go as planned. But if at all possible, try your best to, prior to a deployment of shifts or prior to a shift, do what we call banking sleep. Now, banking sleep refers to if when you're in the bed, try to maintain that supine position as long as possible, probably longer than usual. Let's say that you maybe get 6 to 7 hours of sleep prior to your shift. Do your best to extend that about an hour to 3 hours if feasible. You may not always get additional sleep, but what you can get is additional rest during that additional period while in bed. That activity, what we call as banking sleep, has been shown in the evidence to reduce sleepiness, to reduce self-reported fatigue during the shifts that follow and after the shifts that follow. Again, that is not always possible. When feasible, try to do that prior to the deployment. Another thing to do is if you're initiating a night shift or an evening shift, and you have some time during the middle of the day, let's say early afternoon, try to get a nap. There is some evidence out there that suggests that if you are able to get a nap pre-shift, that does help significantly with feelings of fatigue and sleepiness while doing the overnight shift. So again, a couple evidence-based strategies to potentially follow here. Banking your sleep prior to a shift or deployment of shifts, and when feasible, getting a nap pre-shift. Other strategies that we have highlighted in our research that are always recommended, at least based off of what we've done in recent history, will be napping. Not every EMS organization allows it, but where feasible, try to get a nap during the shift. In terms of the duration of the shift, that continues to be a hot topic for debate. The literature would suggest that, yes, we are susceptible to sleep inertia upon waking from a nap, and the literature is actually inconclusive as to whether or not it's only isolated to certain durations or not, because there is some evidence to show that even if we get a short duration nap, sleep inertia may be present. So, however, the research would suggest that for the most part, shorter duration naps will help to lessen the impact of sleep inertia where feasible. So if you're allowed to do so, I would definitely promote intra-shift naps when feasible. Post-shift, family life gets in the way, social issues get in the way, fear, anxiety, post-traumatic stress related to calls on the previous shift or previous shifts get in the way. One thing to pay attention to is that if you have a week of back-to-back shifts and you've only managed 4 to 6 hours or so of sleep in between shifts, you need to recognize that it's going to take you longer than one 24-hour period to pay back that sleep debt. There's some research that shows that if you go for, let's say, approximately 1 week of work, 5 days or so of work, where you've had limited sleep between shifts, let's say 4 to 6 hours, and you were fortunate enough to get 10, 11 hours of sleep on the first day off from your shift, that's not enough to pay back the debt that you accumulated while working those back-to-back shifts. So be cognizant of the fact that recovery takes time, and it typically takes more than one 24-hour period. So be very aware of your time at home. Try to talk to your family members as much as possible, and it's going to take more than one talk. I can tell you that. To get help with protecting that sleep time, and try to, as best as possible, implement some consistency in the rise time and the sleep time that you are trying to follow at home. You know, the COVID-19 pandemic is new. This is something that most people in EMS have never experienced before. And as mentioned in the previous talk, stress and anxiety, fear are definitely on the rise. And I can tell you that when I go onto my shift, and I've been working shifts ever since this started, and I work usually one shift a week, a 16-hour shift. Now, I don't work as much as other people, but as soon as I get on shift, the handoff conversation immediately begins with sanitation. The truck is cleaned, it's been sanitized, it's been deconned. The station has been deconned. Here's where the medication, where we use medications, it's been restocked, etc. In previous handoffs, it's usually some, anecdotal discussions about the types of patients that we had. And, there may be a casual mention or two about deconning the truck or sanitizing the truck, but now that is front and center. So we mentally have changed how we approach handoffs in probably most EMS operations, because that is a primary concern. And that obviously changes things in our mentality about how we approach the entry of our shift. And I can tell you, for the first 3 hours of my shift, if I'm not on a call, I am wiping down everything. I'm mopping everything. I'm spraying everything. I'm doing everything I can to make sure that if my crew who just left the shift, maybe they missed something. We're all human. Maybe they forgot to wipe down the bar over the head in the back of the truck. And I know I grabbed that bar quite a bit, so I'm going to go in there and wipe it down again, right? So we are now have changed our behavior a little bit, and that can actually impact our mentality. But it's a good thing. It's a good thing that we are taking the caution seriously, and that we're doing all we can to protect ourselves and our patients. The other thing I try to do while on duty is I recognize that in the early morning hours, if we're not on a call or not posting somewhere or doing anything related to patient care, and if I'm not sanitizing something, I need to get some rest. If I'm not writing a trip sheet, I need to get some rest. You should do the same thing. You should try your best, if at all possible, to sit there and rest. Close your eyes. If you're not allowed to nap, just simply resting is beneficial. But if you are allowed to nap, take that opportunity. Don't miss it, because it will help you in the end, not only with your self-rated sleepiness during your shift, but also with your recovery post-shift. It will help you with your recovery. So take that as an opportunity. And then when leaving your shift, this is what I do. We always have to do the handoffs. We always have to do some station duties. Try to wind down as best as possible. That is not always easy. Some people have long drives that they must do to get from station to home. So it does differ quite a bit. But if you are at all able, think about on that ride home, getting that adequate sleep, trying to maintain some consistency in bedtime and rise time, and taking the opportunities to get additional sleep where feasible. That will absolutely help you with reducing stress, reducing anxiety, and somewhat mitigating some of that fear. Sleep is medicine. So try your best to focus on that and to use that as actual medicine. It will definitely help you. I think for the time being, that's probably where we should stop and then open up for questions. Is that right?
Yes, thank you. Also really good information. And I know I've taken the time during the quarantine I bought a Fitbit so I can track my sleep. And obviously my job is not nearly as stressful as yours. It's fascinating to see what your sleep score is. And I don't know if there's any, method to it, but I also think what Krista said about using meditation apps, that's something new to me that I've been using, and it's really helped to, calm things down. So maybe on your ride home, you can use something like that. But I know that you all have so much information to share. Hopefully we'll be able to get you both back. This is so fascinating. So I do have some questions. We'll start with Krista. What would be your top 3 organizational and individual strategies to improve staff mental health?
Oh gosh, I have a long list, so it's hard to narrow it down to three, but I think, knowledge is power. And I think beginning with individuals educating themselves on this topic, I mean, I think there's a shared responsibility between the organization and the individual to pursue, mental health. And so as an individual, I think it's our responsibility to, chase down the things that might work for us. And as you do that, you'll discover other things and be like, oh, I didn't even think about that. So it's a great learning experience to sort of chase down that information yourself. As far as the organization goes, I think that, education upon new hire and then recurrent education is a big one too. But then you also have to structure your organization so that you're actually behaving this way. So for example, it's really easy to say, hey, we want you to call out for fatigue. Here's the criteria. We want you to be educated. Here are the deleterious effects of operating while you're fatigued. And then to chastise people when they actually do that. So the operationalizing these principles, it's okay to ask. It's okay to understand why people call out for fatigue. But if they get the eye roll or the pushback on that, then that's kind of contrary to what you're teaching. So I think that organizations have to really make a concerted effort to sort of practice what they're preaching if they're, if they are teaching this stuff. I think trained peer support teams, I'm a huge proponent of trained peer support teams. And then the last thing probably from an organizational perspective is making sure that people have access to counselors, therapists, clinicians that are qualified to manage this population of professionals. A lot of us have EAP. EAP can be, a little hit and miss sometimes depending on where you are. And so I think that we have to make a concerted effort as an organization to make sure we have qualified professionals that have tools like, EMDR, desensitization reprocessing in their toolbox, cognitive behavioral therapy, of course, neurofeedback is another kind of up and coming, treatment for PTSD. PTSD is not a life sentence or a death sentence. There are great treatments out there for it now. So there's no reason that people should have to suffer with that. And then as an individual, I got the apps. I got Headspace, I got CBTI for sleep. There's a PTSD app. And, it's not to say that you have to have those diagnoses to find value in this. So as an individual, I would say, do your homework on this, use the apps, and then, understand this easier said than done. Myself, I was like, oh yeah, I'm going to start yoga. I need to go do yoga. My gym offers it. I ordered my mat. First step, I ordered my mat from Amazon, sat in the box for 6 months. And then I made a huge step forward, which was taking the mat out of the box. And I still haven't been to yoga. It's been like a year. So I think you have to, be forgiving, and be patient with yourself.
Those are great answers. Thank you. And I know, peer support is really important. And again, it can apply to anyone. And I agree with that yoga mat comment. I've got one still in the box here in my office. So I'm with you. Dan, can you talk a little bit about your NHTSA grant to produce all of the fatigue videos? I think there's one, digital safety stories, and what's the best way for people to access those as a resource?
No, thank you. We have actually several grants underway to test different fatigue and sleep health interventions. And as you mentioned, the NHTSA one, which is in concert with the National Association of State EMS Officials, we spent the past year and a half, almost 2 years, developing 10 brief education modules. They're about 10 to 15 minutes each. They cover a wide variety of different sleep health topics, sleep disorders, alertness strategies, how do you measure sleep health, and fatigue recognition, what is sleep physiology. So a wide variety of topics that we hope are informative for all of EMS, not only air, but also ground. We are in the middle of the intervention study. And as you might imagine, COVID-19 has had a little bit of an interruption in that project. We anticipate collecting data from restarting data collection in the summer, if everything goes okay, barring any major increases in cases and other additional disruptions with COVID. But we imagine within a year, hopefully we can have those freely available, and they will be freely available to all of EMS once we have finished the study. Now, we did release a very brief video on our department website, which I think maybe you circulated, which actually pulls out a few pieces from one of the modules to distribute to everyone now. We can't replicate all 10 of those modules for wide distribution yet, because we're still testing this, testing their application in this one study, but they will be available soon. And I do imagine between now and the release of those 10 modules that we will probably release some additional videos that are some snippets of what we've created. So and then we have a NIOSH study, which is also testing a mobile app. You're talking about apps. We're testing a mobile app and another mobile texting type interface that we've done a lot of pilot work with. So we have a wide variety of interventions that we're trying to test, and they all use different types of technologies. But education and training is important, as Krista mentioned, definitely during the onboarding process and definitely continuously. But the core to any education regarding sleep health and fatigue is that the one solution, the tried and true solution to the fatigue problem is, you already know the answer, it's sleep, okay? And I think EMS has really, over the past 5 years or so, has really started to recognize that. Prior to this, we used sleep deprivation as a symbol of macho, mentality in EMS, something that we were very proud of. We go from shift to shift and we haven't slept a bit. We used to talk about that in grandiose terms and to brag about it. And I think we're starting to understand that that's not a good thing. We are at our worst when we are sleep deprived. We're not at our best. And so I think we're inching away at that mentality, which is a positive thing. How best to create a program that emphasizes sleep health and changes behavior for individual clinicians will continue to unfold. Every agency is a little different. They have their own little quirks. Their people have their own needs and demands. And that's going to be fine. Everybody's going to have a different way of applying different techniques that fits them best. We have a lot of differences in individual sleep needs. So, but the absolute core to all of this is basically get more sleep.
Yes, even for somebody who doesn't work shift work, and my husband says I'm a koala bear because I really could sleep 23 hours a day. I agree with you, sleep is really important. And there are lots of apps out there. And so we look forward to seeing what your app does. And obviously, if you can keep us apprised of as things come out, we can share them on the MedEvac Foundation website and push those out to everybody as well. That would be great. I have a question for Krista. How do you handle individual staff members who are at different stages of PTSD, just like individuals who enter and leave different stages of grief?
That's a good question. So there are, I think, so let me quote Rhonda Kelly. She's our director of GMR Life, and she's responsible for sort of like the resilience and wellness piece at GMR. And she is a big fan of the stress injury formation model. So, basically the gist of that is that we all fall in this continuum. And there's actually a really nice graphic, and I'll tell you the website for that in just a minute, but it goes basically from green to yellow to orange to red. Green being I'm joyful in my life. And, one of the big pieces of that is that I have room for complexity, which is great because our jobs are very complex. And then as you go down the continuum, you can identify, well, I'm becoming cynical, I'm losing my interest, it's hard to focus, all the way down to, I'm isolating myself, I'm using a lot of substances, or maybe I'm even suicidal. So there's this sort of stress injury continuum. And the point is that you don't necessarily, and some people may, but you don't necessarily just suddenly and have PTSD. It probably, in a lot of cases, takes some time to develop. When we're talking about cumulative stress, you can certainly have a major incident that can lead to post-traumatic stress injury. But I think the key is looking at a continuum like that and trying to identify for yourself where you fall in that continuum, or you know, if you're noticing that your employees or coworkers are, you know, maybe they're more cynical, more negative, more irritable, they're isolating themselves, they're just not themselves. And that's kind of the bottom line. If you kind of look at the core of who you are in terms of self-awareness, you know, who am I? Is this me? You know, I'm not an irritable person. I'm not grumpy. I'm not negative. And if I'm sort of, you know, having a sustained, you know, period of time where I am those things, maybe I need to step back and readjust some things and maybe get some help. So the website I would refer you to, actually, if you just Google this, Laura McGladrey, it's McGladrey. She's out of University of Colorado, and she's done a lot of work on this. So if you Google Laura McGladrey stress injury formation, it'll take you to a website where there are some wonderful videos on this, and some of those were done, I think, in conjunction with Rhonda, and they do some really great work on that. So I would really encourage people to look at those videos to understand that better.
Great. If somebody, you know, wants to go take the next step and maybe look into counseling or something like that, Krista, how can you verify if a counselor is a right fit for, you know, they know what somebody in the EMS profession is dealing with as far as that type of PTSD versus PTSD from another situation, because it's all different.
Yeah, you know, that's a hard one, because you have to find people not only that specialize, but also people that you can work with, you know. So the first thing I would say, that sometimes it takes some work to find somebody that fits you and that also has the specialties that you require. So I would say don't give up. If you find a counselor and, you know, they don't work, or you don't like their style, don't give up. But when you're initially looking for clinicians that specialize, you can look them up on, you know, sites like Psychology Today and things like that. And what I would look for is, do they specialize in trauma? Do they specialize in post-traumatic stress? I prefer injury to disorder, but post-traumatic stress injury, post-traumatic stress disorder. Do they specialize in grief? I think there's a lot of grief in this industry that goes sort of unrecognized, maybe unmitigated. And then, do they specialize in all of those things in this particular population of professionals? So first responders. And there are clinicians, there are wonderful clinicians across the country who do specialize in first responders. On the websites that I shared with you that were resources for this group, there are lots of resources by psychologists who've written books on this topic and things like that. But I would look for those specific things. I would also look to see that they do, see if they do things like if they have EMDR in their toolbox, which is a very powerful tool, a very well-studied tool for PTSD. Neurofeedback, as I mentioned earlier, those types of things. So I would look specifically for a therapist that had those kind of things in their toolbox.
Great, thank you. So we have a few minutes left. Dan, I'll give you a couple minutes for any last thoughts, any last tips to share regarding sleep and fatigue.
No, thank you. And thank you again for the opportunity to talk with everyone today. Thank you, Krista, for all that you were able to highlight. The resilience piece, I think, is one that we haven't focused on enough. While we are very fearful that a large percentage of our workers will be negatively impacted by the recent events, I think, and I've recognized this in my own agency, I have seen individuals who have encountered this pandemic in a very different way. And so I think we need to at least recognize, at least somewhat, that there's a large percentage of people in EMS, and it's hard to determine what percentage are negatively affected by this versus which percentage are positively affected by this. And when I mean positively affected, I mean that they feel more resilient as a result of the challenges. They have what is referred to as post-traumatic growth, and there's a thing out there that can be measured by an instrument, a thing called post-traumatic growth. And we have those individuals out there, and I think they need to be recognized, not only in addition to the negative effects that might be coming for some individuals. And for those individuals, I haven't had a chance to sit down with a large number of these individuals, but for those, I would really want to know, how is their sleep going? You know, I think we highlight those who have, in particular in my area of research, the negative aspects of sleep, how shift work has a negative impact on sleep. But there are those individuals out there who are pretty resilient and who have had some experience with responding to this in a different way. And I think we need to highlight some of their characteristics, because those could serve as models for those who are struggling right now in response to the recent events. And I think that needs to be discussed. We need to find those individuals. We need to talk to them. We need to find out what their behaviors and patterns are. And in many cases, they could serve as role models. So I'm very interested in that potentially being a topic of conversation in the future, where we identify those individuals and just kind of have a good discussion to see what their experiences are like in terms of sleep, in terms of stress, in terms of fear, etc.
Great. I think when you identify those people, that sounds like a great webinar for our wellness series. And I like the idea of post-traumatic growth. We talk about, post-traumatic syndrome. I think post-traumatic growth is something else that we can talk about in a positive way. So thank you for bringing that up. Krista, I'll let you have the last word here. Any last tips to share or comments?
Yeah, I just thank you so much for putting this together. It's absolutely a pleasure to be here, and certainly to present with Dr. Patterson. I agree 100%. This industry is full of people who are resilient, who have experienced post-traumatic growth. And I think that what we have here is an incredible opportunity to move the industry forward. And what we need is data and research and the kind of work that you're doing, Dr. Patterson, and all of us working together. There are amazing people across this industry doing great work in this area. And so I, can't thank you enough at the MedEvac Foundation for providing this platform and this opportunity for all of us to come together and share. So I'm really looking forward to seeing where this conversation goes. Thank you so much.
Thank you. Well, consider this an official invitation for both of you to come back. I know you have a lot more information to share, and we certainly hope that you will share it through this venue. As a reminder to everybody, our Run to Help the Helpers is live, so you can sign up for that on runsignup.com. All of the proceeds from that run go to support our efforts in helping first responders who are experiencing PTSD, suicide prevention, mental health support. So please sign up for it to your friends. Anyone can join. You don't have to be. I created my own team this morning. So it's an opportunity to get healthy and support the industry. And this will be available on our website either later this afternoon or tomorrow. And just thank you all again for joining us. This was a fascinating conversation, and I appreciate everyone's time today. So thank you, and have a great afternoon, everyone. And get some sleep.